Good morning, guys. Today we would like to discuss top 10 key facts you must know before a transplant surgery. Guys, in my experience of 17 years, been seeing a lot many patients with variety of doubts, and these doubts, most of the time, few doubts are correct, few doubts are misguided because of the wrong advertisements or whatever it is, and most of the time, a few baseless doubts they come with. In that perspective, I really wanted to make a video to understand what are the facts that one should know before a transplant surgery, and that's what the topic is today. Kindly watch the video until end to understand these basic details before planning your transplant. Question number one, can everyone undergo transplant? This is the question number one. Answer is definitely not possible, because it greatly depends on backside donor availability. If you are a person having a poor donor, then transplantation definitely not possible. So that's the main raw material for the transplantation. Kindly remember that point. Question number two, what is the minimum age and the maximum age for the hair transplant? Usually minimum age 25 or above is better. Maximum age, there is no age limit for the hair transplantation as long as you are fit. Why is minimum age is recommended is because the youngsters would always lose more hair. That is the reason we can consider age 25 or above is better. Question number three, what is the difference between grafts and follicles, and why is it so important? The major difference between the grafts and follicles is we have our hairs are distributed in the scalp in a grafts manner. Each graft can have 1, 2, 3, 4, even 6, 7 follicles. That means one graft has more follicles. So graft is not same as a follicle. So graft or follicular unit are the same, but graft and follicle is not the same. Well, why it is so important to know difference between grafts and follicles is, imagine you are promised for 2000 grafts, and actually 2000 grafts accounts for more than 4000 follicles, but you are charged for 4000 grafts. That is the reason one should know whether you are getting implanted grafts or follicular units, not follicle count. Imagine someone is promised you grafts. That means 2000 grafts means you're supposed to get at least 4000 follicles or more follicles, and that is the reason you should know. And second reason is, when our body has all hairs are distributed in the manner of grafts or follicular units, so we have to implant the same way. We cannot separate the grafts into many follicles to give you more number. That does not give you any good results for you. And that's the reason one should know about the difference between the grafts and follicles. Kindly remember, do not confuse with these words. Graft or follicular unit are one and the same. Follicular unit and follicle is not the same. Each follicular unit can have 1, 2, 3, 4 follicles depending on that patient. So follicular unit and graft are the same. Follicle is different. Question number 4, can we harvest 8 to 10,000 grafts and implant in one day procedure? Answer is, it is not possible to do that way, because those many grafts to harvest and implant, it will take more than 15-16 hours. That much time, if you keep the grafts are outside the body, grafts may die. Number 2, those many grafts are not even available in single donor scalp to do such procedure. So practically doing 8,000 to 10,000 grafts is impossible, and maybe 8,000 to 10,000 follicles possible in single day procedure. Well, question number 5, what is the minimum surgical team or staff that requires to perform 3,500 to 4,000 grafts? Well, to perform 3,000 to 4,000 grafts in single day procedure, at least we have to have minimum of 15 number to 25 number team, including surgeons, including assistant surgeons, including staff. It's not practically possible to sit 1 or 2 assistants and perform the 3,500 to 4,000 grafts, because if you don't implant these grafts within 6.5 hours time, you are keeping it outside the body for longer time, growth rate goes to a toss and your transplant become a failure. That is the reason you need a very bigger team who can do the procedure within 6.5 to 7 hours. Then only you can get the best results. Question number 6, what is the minimum amount of time or duration required to perform 3000 to 4000 grafts. Minimum time required is 6 hours to maximum time 8 hours required, including everything since morning to end of the procedure. That's the minimum amount of time required to do a procedure, while exact time would be around 5.5 hours. Question number 7. Does any fancy techniques would give you best hair transplant results? Well, most of the patients will ask me many techniques are around in the internet. They'll ask me many AFI, DHT, implanter method, sapphire blade, all these many techniques they will talk about. I'm sure no special technique would get you best results, but only your skilled surgeon can get you the best results. Worldwide, the technique is FUE only. A few modifications each clinic has developed. They name it different way, but end of the day, kindly remember there's only technique right now is going on FUE technique. So micro FUE technique is the only technique. All other techniques are little modification of the FUE. So only technique does not give any results other than your surgeon's best skills would going to give you best results. Most of the time, these fancy names of the techniques used for marketing strategies or marketing gimmicks. So kindly remember, your expertise surgeon only can get you the best results than any technique. Question number 8. Does any special tools or instruments get you best hair transplant results? Definitely no. All the instruments are available worldwide for any clinician, for any doctor. Any doctor can buy any instruments online from any surgicals and use for the hair transplantation. There is no such special tool, special instrument that can bring you a best results to you. But latest, finest instruments for a best surgeon would always give you cut above results, final results for you. So because most of the patients are asking me, what are these implanters? What is the sapphire blade technique? Would you do this technique? I'm telling you guys, this sapphire blade is nothing but a crystal blade, cost you around 4,000 rupees, available for any clinician, any doctor in the world. Number 2, implanter cost you less than 1,500 rupees. Disposable implanters are available, the chai implanters are available, flexi implanters are available. All these instruments wouldn't cost much and available throughout the world for everyone. So kindly do not get confused with the instruments and techniques, because your expertise and experienced surgeon can get you best results with the latest available instruments. No special instrument, no special technique can make you best results in hair transplant. Kindly remember this point. Question number 9. How does my donor look after my FUE transplant? And what is the donor management? Well, your donor supposed to look very good and natural if it is done by a best surgeon. If not, I'm sure you're going to get a botched donor and a spoiled backside skin. I've seen many such patients. So that's greatly depends on not on the technique. Kindly remember, it greatly depends on your surgeon's expertise and what kind of technique he is going to use. Here, most of the people think that FUE doesn't give any bad scars, but if someone done by erratic extraction, overzealous extraction, I'm sure that also going to give you a very bad scars for you. And what is the donor management? Donor management is nothing but harvesting the graft such a way that you don't see any defect in the back. A balanced donor, even after the transplantation, if you almost do a military cut, buzz cut, still there is no marks to be seen. And the uniform managed donor called balanced donor called donor management. That means from single donor, we can harvest 3 times without damaging anything in the backside. If erratically harvested, single time, one session can completely damage your donor, where future transplants are not possible. This donor management is only possible with best clinics, best expertise doctors. Last question but not the least, question number 10. What is the grafts processing? Why it is so important during your hair transplant? Well, most of the guys will understand that after implantation they see the pics and that implantation looks so beautiful. Everywhere bulky grafts are placed, they look so beautiful and nicely arranged, but at the end of the day, after 8 months, they don't get best results. They compare with the implantation and the results doesn't match. A reason is most of the clinics, they don't do processing of the grafts. But what is the meaning of processing? These grafts are always available with some amount of skin and some amount of fat. This has to be removed before implantation. If not, accommodation of the grafts is very difficult, and even with a lot bulky grafts with fat would not grow better. To do this, you need more than 6 to 10 people, surgical team, to separate this grafts from the fat, and a little bit skin to be removed. But that is the reason to appoint more number of the team. Most of the guys who don't do this, they directly implant it. Harvestation, they do implantation. Because of this reason, implantation looks so good, but end of the 8 months, you don't get much results. So that is the reason grafts processing is so important to enhance the better growth rate. Thanks for watching this important facts about hair transplantation. Well, each question and answer we can make a very big video. I would like to make a big illustrative video of each question and answer soon later. Kindly watch further videos to understand more detailed information of all these questions and answers. Thank you.